Hello, I'm Bob Ravenscroft, the Vice President for Advancement and Chief Development Officer. We're here for part two of our interview session with our new President and CEO of Bryan Medical Center. What we want to talk about in this segment, Eric, is just to share with the organization about your healthcare experience before you got to Bryan, and then you've had some really interesting roles with some pretty impressive growth and accomplishment.
Upon graduating from Creighton with my bachelor's degree in healthcare administration, I knew that really in order to break into the field and I think set myself up well starting out, going straight through to get a graduate degree, so studied a master's in healthcare administration from the University of Iowa, and started as an administrative fellow at what was then called Allegiant Health, now is CHI Health in Omaha. From that administrative fellow role, I moved into my first management position, managing our radiation oncology departments at Allegiant. Shortly after that, I had a bit of an entrepreneurial bug and a chance to join a friend to help manage private physician practices. So my day-to-day was to serve as an administrator of a 8-doctor ophthalmology practice, private practice in Omaha. Give me this great appreciation for the role of physician practices, independent physician practices, and their contribution to the medical community. From there, had the chance actually to go back to Allegiant to work in the Allegiant Health Clinic, now CHI Health Clinic, for a handful of years in various capacities, business development, specialty care, primary care, etc.
You then went to Colorado and you were at Banner for a while. What did you do at Banner?
Yeah, well, I first actually, when I moved to Colorado, I was working for Centura Health, actually, first in Denver. So working as the director role, and then I was able to move into a vice president of operations role for the Centura Health Physician Group. Centura is actually the largest health system in Colorado with 17 hospitals around the state, a medical group of about 500 providers, really sprinkled all across the state of Colorado. From there, had the chance to then go to Banner Health and to live in northern Colorado. So my responsibility was to support our primary care practices at Banner that constituted in Greeley, Loveland, and Fort Collins, Colorado. Banner, as you know, is one of the nation's largest health systems, 30-some hospitals in 7 states, 35,000 employees, almost 2,000 providers employed across these 7 states, and it was an amazing opportunity to see really big health systems. Banner did a lot of things really well, and it was a great experience, and was fortunate to be a part of their team.
And then you came here. The growth of our physician network has been pretty dramatic in 8 years. You can share the numbers, but share a little bit about that, and then maybe the contrast, because you're talking Centura, Banner, CHI, and then we feel big to ourselves, but in comparison, we're a much smaller and nimble system. So talk a little bit about the differences that you've recognized.
Sure. I think I'd like to first kind of talk about the move from Colorado to Nebraska. You know, we weren't really looking, wasn't really looking to make a career move. I liked working at Banner, and we loved living in Colorado, kind of who wouldn't. But I had mentioned the story of the adoption of our son John, and my wife and I were talking on occasion about it would be nice to be closer to home at some point in time, and actually knew the position at Bryan was open, but hadn't thought much about it until a friend nudged me to apply. And before I actually ever did apply, I actually called Russ as somebody that I had worked with in the past. And Russ told me how special this place really was. And the opportunity to work for a locally owned, locally governed organization was important. The opportunity to work for an organization that was small enough to have this family feel, yet large enough to be able to have resources to invest in growth and do kind of cutting edge things. And so Bryan was just a natural fit. It was a perfect opportunity for me to come, and what I've experienced over the last nearly 8 years is that culture is exactly what Russ told me on the phone more than 8 years ago. When I joined Bryan, our BPN provider group, we had 29 providers total. That included physicians and a small group of nurse practitioners and physician assistants. We now have more than 150 providers employed through Bryan Physician Network. That's in 24 practices, 16 specialties. It's been really remarkable to see the growth. What's been amazing is the growth has not been because we've gone out to seek out the growth. It's really been because providers in the community are reaching out to Bryan and saying, you know, that's an organization I want to be a part of.
You know, everybody on the executive team, we get pulled into operations as well, or at least have awareness of operations of the organization. Just recently, you've taken on a couple of years ago, additional duties for some medical center operational responsibilities. What have you kind of gleaned from that, with most of your experiences being with physicians, diving into the operations that you think will carry forward to your new role?
Yeah, you know, I really couldn't have mapped out a better opportunity, especially leading me into the current role, that when, as you mentioned, 3 years ago, had the chance to really add to a list of responsibilities, serving as Vice President of Operations for Bryan Medical Center by supporting two of our larger departments, one in respiratory therapy and the other in our laboratory space, as well as some other departments, sleep lab, bariatrics, pulmonary diagnostics, neurodiagnostics, among others. And you know, the timing, I don't think, on one hand, couldn't have been worse, on the other hand, couldn't have been better, because that transition happened just before the pandemic.
Yeah, and you mentioned respiratory therapy and lab and pulmonary.
Two of the most critical, if you will, functions that really help sustain and thrive, really elevate the game, both in our laboratory and respiratory worlds. And to watch our leaders operate over the last 3 years, yes, largely during the pandemic, but really even outside of kind of pandemic-specific work, has just been an incredible privilege. It's to see what our teams are doing, both in terms of the innovation as well as in the compassion, has been really remarkable, a privilege.
Yeah, it sure was. Next week, when you see us in the same outfits in the same location again, we're going to talk a little bit about Eric's vision for the future for this outstanding medical center, Bryan Medical Center.